Beware, source of the information provided in the video is purely based on information available online. Take any remedies or treatment at your own risk. These are generic video just to provide you basic general knowledge. Content and advice or anything shown in this video is not verified or provided by any expert. We do not take any responsibility whatsoever. What causes urine to smell like fish, and what exactly can this treat it? Can this cause for concern? Urine consists of water and a small concentration of waste products. Urine typically includes a subtle odor of its own, but that can change or fluctuate for a number of factors. Sometimes, your urine might even choose a fishy odor. Even though this is generally temporary and easily remedied, it can occasionally be an indication of an underlying condition that needs more advanced therapy. Keep reading to find out what could be behind your symptoms, and what you can do to find relief. 1. Diet and dehydration. Your urine contains some of these chemical substances found in foods you've recently consumed. These compounds will carry some of their food's odor in your urine. Keeping that in mind, it is unsurprising that eating fish could cause your urine to have a fishy smell. Caffeine, which can act as a diuretic, asparagus, which can release of sulfur in the urine, Brussels sprouts and cabbage, which release methylmercaptan that can cause a strong rancid or fish smell. Dehydration may also cause or aggravate the fishy smell on your pee. When you are dehydrated, there is less water to dilute the levels of compounds. This will offer your pee a more powerful odor. What you can do: you can avoid foods known to cause fishy-smelling urine. However, this is sometimes difficult to do. Instead, make certain you drink lots of water, particularly if drinking caffeine, to help detoxify the scent and stay hydrated. Urinary tract infection (UTI). Even a UTI can cause germs from the disease to induce the urine, leading to a distinct fishy odor. Other symptoms include urine that's cloudy or bloody, burning or pain during urination, feeling the need to urinate urgently or often, lower back or abdominal pain, moderate fever. What you could do if your symptoms haven't disappeared within 24 hours, visit your doctor. They will prescribe antibiotics that will help eliminate the infection before it spreads to the kidneys. 3. Bacterial vaginosis occurs when there is too much bad bacteria in the anus, disrupting the balance of good and bad germs. This may lead to a grayish, fishy-smelling vaginal discharge which might be noticeable when urinating. Some women with bacterial vaginosis won't experience any symptoms. Discharge that's thin or watery, pain during sexual, painful urination, light vaginal bleeding. Everything you could do. Occasionally bacterial vaginosis will go away on its. If your symptoms persist for a week or more, visit your physician. Your physician can treat it with antibiotics, even although it may return after treatment is finished. Trimethylaminuria. Trimethylaminuria is a rare metabolic disorder that happens when the body is not able to break down certain substances properly. This includes fishy-smelling trimethylamine. Trimethylamine is generated from the intestines after consuming certain forms of food that are high in protein. Together with trimethylaminuria, trimethylamine is discharged into the urine instead of being broken. Everything you can do. Trimethylaminuria is also inherited, and there's absolutely not any cure. But you may reduce your symptoms by avoiding foods that cause symptoms. These include eggs, beans, liver, fish, milk that comes from wheat-fed cows, TSP, soy, distinct types of seeds. 5. Prostatitis. Prostatitis is an acute inflammation of the prostate gland in males. It is caused by a bacterial infection. It may progress quickly. The bacteria in the urine could cause it to smell like fish. Other symptoms may include: should you guess prostatitis, visit your physician. Your doctor will prescribe you antibiotics to treat the disease. While you're looking for the antibiotics to work, your physician can prescribe you alpha blockers. These loosen the bladder neck and reduce painful urination. Anti-inflammatory drugs, such as over-the-counter options including ibuprofen, Advil, may also be effective. 6. Kidney stones. Resistant stones which are moving from the kidneys can result in an infection somewhere in the urinary tract. This infection will influence the urine, and can bring about urine that smells like fish. It could also lead to blood in the urine or cloudy urine. Kidney stones can cause severe pain that radiates from the back and side down towards the stomach. This pain will arrive in waves and change in strength. It might cause vomiting and severe nausea. Everything you can perform some kidney stones may pass in their very own, however if you are experiencing severe pain you should see your doctor. Your physician can prescribe pain medication to produce your symptoms more bearable. They can also prescribe an alpha blocker to relax the bladder and make it much easier for the stone to pass. If the stone is larger and at risk to become stuck in the urinary tract, your doctor may do surgery to get rid of it. Although liver problems generally don't result in urine that smells like fish, it is possible. This is especially true of both liver failure. This takes place when the liver is not functioning properly, and is not able to process toxins because it should. These toxins are then released in the urine, causing the powerful odor. If liver troubles are causing fish-smelling urine, then you are most likely to notice other symptoms, also, including thicker, darker pee infection which becomes difficult, partially because of the thicker urine, jaundice, nausea, lack of appetite, diarrhea, fatigue. Everything you could do if you're experiencing symptoms such as these, see your doctor. Your personal treatment plan will depend on the investigation. Some liver problems will be treated with lifestyle modifications, including a modified diet and possibly losing weight. Others may need treatment, including dialysis or operation. Cystitis refers to inflammation of the bladder. It is often brought on by a fungal infection, like a UTI. The bacteria from the infection may result in a strong fish smell in the urine. Other indications include a powerful, persistent urge to urinate, passing small amounts of urine frequently, burning during urination, cloudy, damp, or strong-smelling pee, pelvic discomfort, strain at the lower abdomen, fever. What you can do if you suspect you have cystitis: see your physician. They will probably prescribe you antibiotics to get rid of the disease before it spreads to the uterus. You can use a heating pad to relieve discomfort. Drinking plenty of water can help flush the infection from your system. Phenylketonuria is an uncommon inherited disease that raises the number of phenylalanine in blood. This may cause a buildup of this chemical within the human body in addition to a higher concentration of phenylalanine from the urine. This can result in a fishy odor. Phenylketonuria usually affects babies. If the gene was passed on to your child, they will start to display signs of phenylketonuria over the first few months of being born. Other indications include delayed mental and social abilities, hyperactivity, head dimensions that's much smaller than usual, skin rashes, tremors, seizures, jerking movement of the arms and legs. Everything you can do. Phenylketonuria can't be cured, but treatment can be highly capable of managing symptoms. It's essential to stick to a diet low in phenylalanine. This implies avoiding foods containing the substance, for example, milk, cheese, some synthetic sweeteners, fish, chicken, eggs, legumes. 10. Trichomoniasis. Trichomoniasis is a sexually transmitted infection (STI) caused by a protozoan parasite. Some people with trichomoniasis will not experience any symptoms in many women, but the infection causes vaginal discharge that has a strong fish-like odor. This release can be clear, yellow, white, or greenish. Other indications include genital itching, draining near the genitals, soreness or swelling of the eyebrow, pain or discomfort when urinating. What you can do if you guess trichomoniasis: visit your doctor. They will prescribe oral antibiotics to clear the infection. To prevent reinfection, wait 7 to 10 days after you and your spouse have completed treatment to resume sexual activity. If a urine has started to smell like fish and there isn't an obvious reason, such as dehydration or diet, create an appointment to see your doctor over the next few days. You must see your doctor as soon as you can if you are experiencing painful urination, blood in the urine infection. You should seek emergency medical care if you're experiencing severe pain while urinating, nausea, severe back or abdominal pain, fever of 103 degrees Fahrenheit, 39.4 degrees Celsius, or greater. In these scenarios, you can have a kidney stone, or an infection that is spreading to your kidneys.